Namaste and hello everybody. Today we're going to talk about the trio of restlessness by Dr. E.B. Nash, and as you know that he groups remedies together on the basis of a similar characteristic indication which is present in all those remedies. So here he forms a trio meaning three remedies which contain the characteristic symptom of restlessness. So this restlessness is present in the remedy Aconite, in the remedy arsenic album, and also in the remedy Rustox. So now Dr. Nash will talk about these remedies, will compare them amongst themselves a lot so that we can, if you're a student, you can answer good in Viva and you can write better in your exams. And if you are a practitioner or any student is eventually going to be a practitioner, when a patient comes to you with restlessness, you can differentiate between these three remedies because these three contain it as a characteristic, but all of them have differences. Okay, and we can come to single one of them, we can come to the most peculiar presentation covering a single remedy, right? So today we're going to talk about the remedy Aconite. Okay, so let's start. So, as we always do, let's first understand what are the topics which Dr. E.B. Nash discusses under his in his book. So he talks about the fever first of all. Aconite is great fever remedy, and he also points out that how aconite has been abused because it is very famously known that it is a great fever remedy, and he also differentiates it with belladonna because both of them are used in the first stage of inflammation. And then he goes on to explain us about the pain, in which we will also talk about the pathophysiological, or actually only the physiology of pain. How do we actually feel pain in addition to the aconite symptoms of pain, obviously. And then we will understand about the fear of aconite, which is a important characteristic in aconite. Aconite is a very fearful remedy, and we'll learn about that. And then restlessness, which is the very point on which he has grouped the remedy along with arsenic and rustox. And arsenic and rustox will also be covered in the following videos. Then he all obviously differentiates all the three remedies on the basis of restlessness, which he also does in other following rustox and arsenic. And then there are modalities, which he always mentions in every remedy. So see, all these points are very very characteristic of aconite. So actually Dr. Nash explains this remedy very beautifully in a brief way. Okay, so although his explanation is very short, but it does contain all the important points that aconite should have, and it is a very crisp and beautiful explanation. So let's start with fever, the first point. So Dr. Nash tells us that in fever, aconite is usually useful in high grade fevers, or in fevers which are cyanocal or inflammatory. The meaning of cyanocal is nothing but continuous fevers, okay, just like typhoid, which is a continuous fever. So continuous fevers are present, or they can be inflammatory fevers, and they are very high grade fevers. Then he goes on to explain that there is no better picture in a few words of aconite fever than is given by Dr. Herring. So he mentions what Dr. Herring writes. Dr. Herring writes that this patient of aconite will have heat. As you know, there are three stages in fever: heat, sweat, and chill stage. So in the heat stage, there will be thirst in this patient. Okay, in aconite there will be heat with thirst, and there will be hard, full, frequent pulse. So the pulse will be hard, full, and frequent. Okay, some patients might have a very dull pulse, but in a comparison to that, this patient has a hard, full, frequent pulse. Okay, the patient is inappeasable. You cannot appease him, you cannot please him. The patient is besides himself, anxious, impatient, tossing about in agony. Okay, now, this word agony is very important for aconite. You should remember agony, this word itself, when you have to talk about aconite. Okay, in aconite there is agony, which means that there is extreme mental or physical, whatever, pain and suffering. It is great pain or suffering which this patient feels. Okay, that is agony, and he keeps tossing about, like he's lying in this bed and he's keep tossing about because he's tossing about in agony. Okay, so that is there because he's restless. So he's tossing about in agony. There's anxious impatience. So he's impatient. There is anxiety along with it, fear, because we already saw that fear is a topic, because fear is a very important aspect of this remedy. So they'll be anxious, they'll be impatient. Okay, They will be beside himself because of the great suffering that they are going through. So that is how, in a few words, Dr. Herring describes the fever of Aconite, and Dr. Nash tells it to us. Okay, and now he points out towards the custom which was being practiced by physicians, or maybe is practiced by physicians, which is not correct, that according to Dr. Nash. So the custom of alternating Aconite and Belladonna in inflammatory affections widely prevails among physicians. So he says that what physicians do is that they all of them know that Aconite and Belladonna both are very useful in inflammatory conditions, especially in the first stage of inflammation. So most of the physicians, or many physicians, will do a custom, will actually follow a method that they will alternate Aconite and Belladonna with each other when their patient comes with inflammatory affections and they have fever. Okay, but Dr. Nash does not uh, guide us to do this. In fact, he talks against of this. In fact, he even says that if you give these remedies in alteration, okay, if you give these remedies in that way, even then both remedies cannot be indicated first of all at time, and even if you give, a good effect follows their administration. Okay, you have given it, and after giving, the patient also felt good. Okay, he is now all well, but now you may be sure that the indicated one cured. You should be sure that only the indicated one cured. Okay, it was not like this alteration method helped, but suppose this patient came with a few symptoms, and the few symptoms were of Aconite, but you gave Aconite and Belladonna in alternation. So Aconite helped that patient, and Belladonna only hindered or did nothing, and only Aconite helped, and that is why the patient is feeling well. And not because he gave these remedies in alternation, but because one of them was indicated. So that is what Dr. E.B. Nash tells us, and after which he says that there are many differences in these two remedies, and the next thing he does is to differentiate them. Before that, let's also talk more about what he tells us about fever, a concept. He mentions a few words by Dr. Dunham. So what does Dunham write? So Dr. Dunham writes that Aconite is never to be given first to subdue the fever. So what you suppose, what some people do is, if a patient comes with fever and there are a group of symptoms that the patient presents with, what they will do, because they know that Aconite is a great fever remedy, so what they do is they think that first I will give Aconite so that the fever goes away, and then I will look at the symptoms form a totality and give another indicated remedy. Okay, so he says that Aconite is never to be given first to subdue the fever and then some another remedy to meet the case. Okay, it should never be alternated with other drugs for this purpose of controlling the fever. So what people think is, because Aconite is a fever remedy, let's give Aconite, it will control the fever, and after that we will give the indicated remedy. But it does not work that way. Homeopathy does not work that way. Okay, when the patient comes to you, you take the symptoms that he has along with the fever, and with the whole totality along with the fever, you prescribe come to a remedy and prescribe that remedy, and then it will reduce the fever. And you cannot just go on doing this, that you will control the fever first with Aconite and then it will not happen. Okay, so that is what Dunham says, and and Dr. Nash wants to tell us, because many people abuse Aconite in every fever case. Okay, they will use it as a fever remedy only. So any patient comes to you and has fever, they give Aconite, but that is not how it should be done. That is what he points out. Now let's go to this differentiation of Aconite and Belladonna. Okay, so Dr. Nash gives us a whole table of differentiation. So when he talks about them, he mentions the title and the differentiation. So in the skin, both the remedies have great heat. Okay, both the remedies feel great heat. But how are they different? So in Aconite, there is dry, hot skin. Okay, the skin is very dry, very hot, but there is no sweat. No sweat at all. But when we talk about Belladonna, there is great surface heat again, like in Aconite. But Belladonna will sweat on the covered parts. Okay, so whichever parts are covered with clothes or whatever, with blanket, they will sweat, the other parts won't, and there is great surface heat. But in Aconite, no part will sweat and there is dry, hot skin. That's how we differentiate the skin or the great heat of the remedies. Then it comes to the characteristic symptoms of both of them. In Aconite, the patient tosses about in agony, as we've already discussed, plus there is great fear of death. So, as you know, fear is a characteristic remedy and the characteristic indication of this remedy, but the fear of death is even more. So, in fear, if you see, fear of death is the most characteristic. So, they have a great fear of death, along with which they toss about in agony. And when we talk about belladonna, belladonna is in a semi-stupor kind of state along with jerks and twitches in sleep. So whenever they are asleep, they will have this jerks, twitches, okay, in their body, and they will be in a semi-stupor kind of state. Then we go on to the great affinity of organ. Okay, so both these remedies have a great affinity on a specific kind of organ. So in Aconite, we see that heart and chest are involved. There is distress that they feel in the heart and chest, especially. Okay, the heart and the chest is the main organ which is affected in Aconite. But when we go to Belladonna, Belladonna, my head is more involved. Okay, everything seems to center in head is what Dr. Nash says. So everything in them, whatever is there, whatever problem they have, everything will seem to center in the head. Okay, so head is the main issue here, chest or heart is the main issue. Fear of death with much delirium, as we've already seen, fear of death is very very characteristic in Aconite, and in Belladonna there is fears, imaginary things with delirium. So something which is not present, which they will imagine, and they will fear the something that they have imagined themselves, and along with which there will be delirium. So the delirium is there in both the remedies, but fear will be different. These people will fear death and these will fear imaginary things. So in this way, he differentiates both the remedies. Skin will be dry hot in both of them, but no sweat and sweat. Here they will be toss about in agony and there will be great fear of death. Here they will be in stupor plus jerks and twitches in sleep. Okay, and here the heart or the chest is involved. Here the head is involved. Here fear of death is there. Here fear of imaginary things along with delirium. All right, and then we'll talk about the pain now. So let's talk about pain of aconite. First of all, Dr. Nash mentions that the trio of pain is also there, in which aconite, chamomile and coffea are there. So coffea is a remedy made from coffee, beans or coffee actually, okay? And chamomile and aconite. So these both are plants, okay? So these three, which are all three are actually plants. So are the remedies which will come under trio of pain, because these three have the maximum amount of pain. So when we study different remedies have different intensity of pains, right? So these three are the most painful remedies in our Materia Medica. That is what Dr. Nash has to say, okay? And we should remember. So trio of pain is aconite, chamomile and coffea. You should all remember. Then he comes to the pains themselves. So in aconite, the aconite pains are usually accompanied by, so what accompanies? So extreme restlessness, which is obviously there because this is a restless remedy, anxiety and fearfulness, which with these both are again characteristic symptoms of aconite. So if maximum intensity pains are present, restlessness is present, fear is present, you should think of aconite, because then it gives a tick mark on three most characteristic symptoms of this remedy. Alright, so that is what he is saying. Aconite pains, extreme restlessness, anxiety, and fearfulness. Now, due to the pain which this patient has, aconite has, the patient tosses about in agony. Again, what is agony? Agony means great pain or great suffering. So, because of that, the patient will toss about, okay? When he's in the bed, lying down, he'll keep tossing about, okay? And then in the pain, patient cannot bear to be touched. Okay, they do not want anybody to touch them. We also saw this symptom in some other remedy. I hope you remember. It was arnica. Okay, arnica does not want to be approached because they fear that somebody will touch them and that will cause them great pain. So in these patients also, since the pain is to such an intensity, they cannot bear to be touched nor to be uncovered. Okay, and aconite pains are intolerable. They cannot tolerate. So these pains are so much that they cannot tolerate. Okay, Dr. Nash says that, well, you say all remedies have pain. So now, when I'm telling you, when he's actually telling us, not me, that the pains, aconite pains are intolerable, people will say all remedies have pain, but not all, and not so many so intense pain. That is what he says. Aconite has intense pain, which not all remedies will have. Now he compares this with opium and stramonium, because opium and stramonium are painless oftener than pain. So these remedies are more often painless. Okay, they do not have any pain at all. Okay, painless remedies, opium and stramonium, and very very painful remedies are aconite, chamomile, and coffea. Trio of pain. Trio of restlessness, which we are discussing about, is aconite, arsenic, and rustox, right? So, trio of pain is aconite, chamomile, coffea. Aconite pains are accompanied with restlessness, anxiety, fear. Due to the pain, the patient will toss about in agony. In the pain, the patient does not want to be uncovered or touched. Aconite pains are intolerable, great pain, and comparison if we'll do, we'll see that opium and stramonium are painless and oftener than painful. So this actually shows you the great fear and anxiety that this patient has. This shows you the heart affection and the chest affection and the great pain, the expression showing you the great pain. Now, aconite pains are generally worse in evening and at night. Okay, this is also a very important symptom, and in evening and at night, these pains will be aggravated. Then numbness, tingling or formication in alteration or conjunction with the pains takes place. Okay, along with the pains or in alteration with the pains, the patient will feel numb, may have this tingling or formication. Here he compares Rustrox and Aconite. Okay, in Rustrox also this numbness is present along with pain. Okay, that is why he differentiates. So in Rustrox also numbness is present along with pain, and the pain is dull, aching, and also there is soreness. And this soreness is something that leads. Okay, and numbness is present plus there is soreness, but soreness leads. In Aconite the pain predominates. The pain is extreme. Okay, so much pain that Rustrox has this dull pain. No, it is not very intense and sharp and acute. It is dull aching. But in Aconite, the pains are acute, sharp, violent, extreme. Okay, that is how they are differentiated. Now, as we have already discussed, we were going to talk about the physiology of pain, right? So let's talk about it, and it's very interesting. Actually, it's very interesting for me at least, because we all feel pain since we are born. Okay, it's a very normal response that we have, and we do not know how we actually feel this pain. Okay, how it actually gets registered in our brain. So let's see, because it's very very interesting for me. So this pain is actually, there are receptors for pain. There are receptors for pain which are present on our skin. Actually, okay, they are present on our skin, and they are called as nociceptors. Okay, these receptors are called as nociceptors, and these are present on our skin. From our skin, whenever we get a stimulus, this goes to our spinal cord, right? This goes to our spinal cord through neurons, obviously. So through neurons it goes, and then it reaches the spinal cord, from which it again goes and travels to the thalamus through the second order neurons. So these were the first order neurons, then it will go from the through the second order neurons to thalamus, and then finally the sensory cortex, and here it will be sensed. Okay, here finally you will understand that you have pain. Now, how does this happen? So these neurons actually get the information through the free nerve endings which are present in the skin. So these nociceptors are nothing but free nerve endings. Okay, so there are these free nerve endings which are present in our skin, and these give the stimulus to the neurons, then neurons to spinal cord, thalamus, and it goes on to sensory cortex. So these free nerve endings actually are of two types. Okay, they can be A delta nerve fibers, or they can also be C nerve fibers. So these are the names that they have. Okay, so both of these types. Now, why do we have two types of them? So A delta nerve fibers are actually responsible for the acute pain that we feel, or the sharp pain that we feel, the fast pain. So if something happens and immediately I can sense the pain, so that is the sharp, so that is the fast pain. Okay, acute and sharp is like very extreme. So especially in Aconite, A delta fibers must be involved, right? Now we know that, right? Yeah, so there's acute pain, there's sharp pain, there is fast pain which happens through the A delta nerve fibers. But when we talk about the C nerve fibers, they are more involved in the chronic kind of pains. Okay, the pains which are felt by the old patients, the old age patients. Okay, chronic pains which are slow pains, which are kind of a burning which goes on for long. So these kind of pains are present in C nerve fiber. Through C nerve fibers we can feel them, and through A delta nerve fibers we can feel the acute pains, okay, which are sharp. Now, here we can also talk about cancer, because since we talked about, see, opium and stramonium which do not have pain at all, there is no pain, and we talked about aconite, chamomilla, coffea which have intense pain. So let's talk a little bit about that also in physiological language. So there are two types of things, right? There is hyperalgesia, sorry, and there is analgesia. Right? So analgesia you all must be knowing. Analgesia means no pain is felt. Now hyperalgesia, you can make out that hyperalgesia means extreme pain is felt. So why does this happen? Okay, so hyperalgesia happens actually when there is inflammation. In inflammation, as we know, that chemicals are accumulated, right? As a part of inflammation, always certain kind of chemicals which are good for our body will accumulate and give rise to the defense response of our body, right? So that is why during inflammation some chemicals will accumulate around nerve fibers, these free nerve endings, these free nerve endings. Okay, these free nerve endings. So chemicals accumulate around this free nerve. What are these chemicals? Nothing but the same things which we see in inflammation, like the prostaglandins, like this, the serotonin substance P, the histamine, bradykinin, especially bradykinin, okay, because it is the most powerful, most potent chemical which gives rise to hyperalgesia. Okay, bradykinin, never forget. Okay, now bradykinin. Now what happens is when these all accumulate in the around the free nerve endings, okay, it gives rise to, it actually gives more firing to the spinal through the neurons to the spinal cord, then to the thalamus, then to the sensory cortex. So more firing takes place, because of which the pain perception also increases. There is increase in pain perception. You feel the pain a lot more now. Okay, and what happens in analgesia? Now let's see. Okay, what happens now whenever you have these nerve endings, right? These free nerve endings which give rise to the pain. These free nerve endings are activated. So, when these free nerve endings get activated, they actually convey this information. Okay, whenever they convey this information ahead, they do it through the sodium channels, because there is depolarization, and for depolarization you need voltage gated sodium channels, right? You need these sodium channels which are voltage gated first. Okay, so you need this. Now what happens in analgesia is there are some kind of chemicals which will block this sodium channels, which will block these sodium channels. So because of the this block, okay, now the neurons cannot relay the information, cannot convey the information to the spinal cord, to the thalamus, to the sensory cortex, and therefore even if there is some kind of injury or inflammation, since the information is not reaching to the sensory cortex, you cannot feel pain. No pain. Okay, there is also a syndrome which in which the patients do not feel pain at all. So it is called as CIPS, meaning congenital insensitivity to pain syndrome. Congenital insensitivity to pain syndrome. Isn't it interesting? Very interesting, right? In this syndrome, the patients won't feel any pain because of this same phenomena. And in normally also, why does this happen? Okay, why are these getting blocked? Because there will be some endogenous chemicals, like your own body will produce certain kind of chemicals which are called as opioid analgesic chemicals, and these will block these channels. We will talk about this physiology in detail when we will be discussing about the remedy opium, remedy stramonium. I will discuss this physiology again in depth about analgesia and how this takes place. Okay, for this video for Aconite, we need to know about hyperalgesia, which is inflammation and due to which chemicals accumulate in the free nerve endings, giving rise to increased pain perception. So now you know how pain is actually felt, why do we feel pain, and how do we feel pain. Okay, so I hope that was interesting for you as well, and let's move ahead and talk about the fear of this remedy. So here Dr. Nash says that fear is the leading characteristic of this remedy. Leading characteristic, okay. It is almost always present when aconite is clearly indicated. So when you have a patient and you are thinking of aconite and if fear is present, because fear is so characteristic, okay, it is almost always present when aconite is clearly indicated. Now, this remedy, as I've already told you, has fear of death, right? Fear of death especially present. So there is fear of RIP, death. Okay, so there is fear of death which is especially present. There is also other fear. There are also other types of fears that they have, but this is special. Okay, in fear there is they have fear to cross the street, to go into society or in crowd. Actually, something they fear that maybe something is going to happen. The fear is ever present. It is undefinable, unreasonable. Okay, maybe you cannot even reason it out why this fear is present, but it is still present. It is undefinable. How can you define such great extent of fear? It is ever present. It is something you will feel that maybe something is going to happen, that will give them fear. Something is going to happen to go into crowd and to cross the street. He also says that no remedy has it, means has fear in such a degree as this one. Okay, so this remedy has fear also and fever also. Okay, in fear there is fear of death especially, remember. Okay, now we'll go to the differentiation that he gives us in the important symptom of restlessness of this remedy. So Dr. Nash very beautifully differentiates the three remedies. All these three have actually the similar symptom of restlessness, and we know as he starts writing about Aconite, the very first line that he says is that all these remedies are equally restless. Okay, all these remedies are equally restless, yet all are so different that there is no difficulty in choosing between them. So they are very different and there is no difficulty in choosing between them, but that you will know only when you study their differences. So what are the differences? In Aconite, there is fear plus there is pain, and this much we have already understood, which leads to agonized restlessness. So agony is already there and there is restlessness. Agonized restlessness is there because of the fear and the pain together. That will give rise to this agonized restlessness. Now in arsenic, what happens is there is restlessness in them, plus there is extreme prostration, plus there is reduced vitality. Okay, you cannot say that restlessness because of this or because of that. There is this inherent restlessness that is present in arsenic. Along with it, there is extreme prostration. Okay, they are very, very tired, fatigued, exhausted. And we've seen a prostration in another remedy as well that we've discussed on our channel up till until now, which is, I hope you remember, it is colchicum. Okay, so colchicum also has extreme prostration and arsenic has it to a great degree. Okay, so restlessness plus extreme prostration plus reduced vitality. So the whole vitality is reduced. They are kind of pale. I know they have this Hippocratic face. So there's reduced vitality basically. Okay, and in rust ox there is aching pain which gives rise to restlessness, which makes him want to move. Due to this aching pain, we just now discussed there is dull aching pain in rust ox. So due to that pain, the patient wants to move. So this is how the restlessness different. Okay, here there is fear and pain. The combination of the fear and pain together is giving rise to this restlessness, which is agonized because of the pain, right? Agonized restlessness because of fear plus pain combo. And here restlessness is there, plus there is prostration, extreme exhaustion, fatigue, plus reduced vitality. Aching pain here gives rise to restlessness. Now in Aconite, there is not as much relief from movement as rust ox. So restlessness means what? They want to move. They want to keep moving. So with this restlessness also, even if they move, there is not as much relief as you get in rust ox. So there is little relief, but not great relief as you find in rust ox. So in rust ox, they get temporary relief from movement. They get relief from movement. They all their symptoms will go away if they move. But in Aconite, it's not like that. It will relieve them a little bit, but not as much. And in arsenic, what happens is they want to move from place to place, but they are not relieved because of it. He wants to move. Okay, he will move, but he will not feel better because of it again. Okay, he will not at all feel better. He will completely feel better. He will feel better, but not as much as rust ox. So that is how these three remedies are differentiated on the basis of restlessness. I hope it's very clear and it has got imprinted into your brains. Now when we talk about the modalities, again Dr. Nash mentions fright. So you see how important fear is. He says that fear of aconite is connected with the acute inflammatory ailments which may be either immediate or remote. If the patient receives a fright in the dark, so if he goes in the dark and he feels very frightened, he is always afraid in the dark afterwards. So even if one time he gets frightened because of something, he will be always fearful of that thing now, because it is a very important thing in this remedy. Okay, from fright, these patients will get vertigo. So see, fright is of emotion, an intense degree in which they are feeling it, but because of that these people get physical ailments. Okay, this is an emotion but getting physical ailments because of that. Okay, so vertigo, fainting, trembling. Okay, they will tremble due to fear. They might faint because of the fear. They might get chakkar, vertigo due to the fear. Threatened abortion also. So a lady who is pregnant and she gets exposed to something and gets very very fearful because of that, very very afraid because of that, very very anxious, that may also give rise to threatened abortion, meaning that the patient is on the verge of abortion, may get aborted, the baby may get aborted because of the extreme fear. So that is threatened. Okay, they fear that might happen. So that is threatened abortion. There is suppressed menstruation. Okay, so they might not get menses because they're so of they they got this fear which was very acute fear. They saw something in the dark, or they just move in the dark and something loud noise happened. They got so frightened that in that month they didn't get their menses, or after that they didn't get their menses, they had amenorrhea after that. So that can also be there in aconite. Okay, there may be jaundice by induced by it, and which becomes chronic. Now, this fear of aconite is connected, as I told you, to acute inflammatory ailments, either immediate or remote. And if the patient receives a fright in the dark, he's always afraid to go in the dark afterwards. Other remedies for fright are opium, ignatia, veratrum album, etc. So, opium we've already discussed right now for painlessness, but this remedy also has fright. See how beautifully they are different. Aconite also has fright, opium also has fright, but aconite is presenting with extreme pain, whereas opium is presenting with complete loss of pain, no pain. There is nothing called as loss of pain, but there's no pain in opium, and there's extreme pain in aconite. Ignition and veratrum are also remedies for fright. Let's go to the second modality, which is the aggravation from dry cold air. Okay, so they have this aggravation from dry cold air. No remedy has more prominently acute inflammations arising from dry cold air. That is what Dr. Nash sees. So we should never ever forget about this. So whenever any patient comes to you, okay, he tells you that I got this cold and cough after getting exposed to dry cold air. Okay, maybe I had gone to some hilly area in winters and it was very dry, there was cold air, or maybe whatever. Okay, there was dry cold air, they got exposed to it, they got cold and cough, or they got some ailment. So no remedy has more prominently acute inflammations arising from dry acute condition which is arising because of this dry cold air. You can think of aconite in those cases. 19 out of 20 cases of croup, which means bronchitis actually. So 19 out of 20 cases will arise from exposure to dry cold air and will be cured by aconite. That is what Dr. Nash has experienced in his clinic. So he says that if you have 100 cases, suppose you if you have 20 cases, then 19 out of them, meaning only one is not there, so majority of them will arise from exposure to dry, who have come to you with this ailments from that they have been exposed to dry cold air, will be cured by aconite. So this is like such a proportion. You see this ratio, 19 is to 1, so only one remedy is different. Okay, 19 of them will get aconite and will be cured by it. So this you should never forget, dry cold air aggravation. The other remedies leading dry air aggravation remedies are Bryonia, Causticum, Heparsilk, Nux vomica. Bryonia also has aggravation from dry air which is coming to them, Causticum, Heparsilk and Nux vomica as well. Some wet weather remedies now, because we've already discussed now about the dry air. So let's also see some different season. Okay, so if there are wet weather remedies, like rainy type of season is there and you have this wet weather remedies, the remedies are Dulcamara. So they will get aggravated from the damp kind of atmosphere. Okay, Nux moschata, Natrum self, Rustox. So see, these are very important. See, Rustox we're going to talk about. So remember this. Okay, wet weather remedy is getting aggravated from damp, Dulcamara, Natrum self, Rustox and Nux moschata. Okay, so this was about the remedy. We've already also talked about the last point, that was the modalities. Let's revise. Okay, so very first we talked about the fever of the remedy, which was thirst along with heat, and the pulse was very frequent and hard, and there was this agony and anxious feeling. And then we talked about how physicians alternate aconite with belladonna while giving them to a fever patient, but it should never be done. And Dr. Nash also points out the differences between both of these remedies, so that you never make this mistake of considering the patient of aconite to be of belladonna or patient of belladonna to be of aconite. Okay, you'll always come to one remedy amongst them when you have a patient, because there are such differences. Okay, the main differences being that the heart and chest is more involved in aconite, but the head is more involved in belladonna. Okay, fear of death is more important in aconite, but there are imaginary things called fear in belladonna. In aconite we saw that there is no sweat, but belladonna has sweat on covered parts, and both of them have this hot kind of skin, right? And then we also talked about the pain of aconite, in which we saw the trio. First of all, which is chamomilla, coffea, aconite has the trio of pain. Aconite pains may, there is aconite pain plus restlessness plus there is fearfulness. And then we saw that due to pain the patient will toss about in agony, and he does not want to be touched or uncovered, and the patient will have this intolerable pain. They cannot tolerate the pain, And we also talked about opium and stramonium, which do not have pain at all. Aconite mile, evening and night, maybe the pains will get aggravated along with numbness, vagara will be there. Okay. And then we talked about how Rustrox also has numbness, but in Rustrox there is dull aching pain, whereas in Aconite there is sharp, acute kind of pain. Then we talked about the physiology of pain, which I would like to actually show to you once again. So here we saw that the pain, actually the pain receptors are present on the skin, which are also called as nociceptors, which are actually free nerve endings. These nociceptors of free nerve endings will carry the convey the information through the neurons to the spinal cord and then the thalamus and then sensory cortex. The free nerve endings are of two types: A delta nerve fibers and C nerve fibers. A delta nerve fibers will give rise to acute pain, sharp and fast kind of pain. C nerve fibers to chronic pain with slow and burning. Then hyperalgesia and analgesia are two types of things. Analgesia means no pain, hyperalgesia means intense pain. So inflammation whenever happens, then chemicals will accumulate around the nerve, free nerve endings, and these will actually give rise to more firings in the neurons, which will finally give rise to more pain perception. In analgesia, there is free nerve endings which work through depolarization. So they depolarize and therefore this information is conveyed. But now this depolarization, which needs sodium channels, are itself blocked because of the endogenous chemicals that are produced. So your own body produces some kind of chemicals which will block these sodium channels so that you do not feel the pain as too much as intensity that it is present, and therefore there is no pain. There is a disorder also, CIPS, which is congenital insensitivity to pain syndrome. Okay, so that is there also. So in this syndrome there is no pain at all only. Okay, so this is how it takes place. And then we talked about the fear of the remedy. Yeah, in the fear we talked about how there's fear of death, fear to cross street, fear to go into society, but the main important fear is fear of death. In modalities we talked about the fright, how there is fright giving rise to somatic symptoms, and we talked about other remedies like opium, ignatia, veratrum, which are also present for fright. Then we talked about the aggravation from dry cold air, which is very characteristic, because 19 out of 20 cases will have aconite, which will cure this, the symptom, acute symptoms, which are acute condition which is arising because of dry cold air. The other remedies which we have discussed for dry air are bryonium, causticum, hyperacid nux vomica, and for wet weather, dulcamara, nux mosquito, natrum sulfa, and rustox. So that's all about aconite. I hope that you understood it in detail, because in details actually this actually Dr. Nash has not given the remedy in detail, but he has actually mentioned it in very short but very beautiful and crisp, so you get the whole essence of the remedy in this short short explanation only. So all thanks to Dr. Nash, and I hope you read this remedy from Dr. Nash and from the other authors also. And let's meet again in the video about of arsenic album, right? So bye bye.